All right, we're going to call our meeting to order. Begin with our Pledge of Allegiance. Everybody stand for that. I pledge
allegiance to the flag of the United States of to the republic which stands one nation under God, indivisible, with liberty and justice for all.
How about a roll call?
Commissioner Hoffmeister, Commissioner Houts,
Here.
Commissioner Lenson,
Here.
Commissioner Collins,
Here.
Commissioner Schaefer,
Here.
Commissioner Stone.
Present. Okay, everybody's had a chance to look at the agenda. I have. Move to approve. I will support it. Okay, we have motion to support. Any discussion on that? Hearing none, all those in favor say aye.
Aye.
And you support
No,
Opposite.
no, he moved, I supported.
He's always.
trying to help Tracy.
I know. I just
They don't even know what. Motion by Commissioner House, support by Commissioner Leininger.
we waited for Teresa and then she just disappeared again.
I don't know what happened.
All right. So we're up to approval of the minutes.
No, we didn't vote on the agenda.
I thought we did.
Maybe I just read.
You may have interrupted me,
Yes.
actually. I thought we did, but we'll go back to that. All those in favor of approving the agenda, say aye.
Aye.
Any opposed? All right, agenda's approved. Okay, so.
Support.
Okay, we have motion of support. Is there any discussion on that? Hearing none, all those in favor say aye.
Aye.
Opposed? All right, motion carries. We're a little out of sorts this morning, but I'm sure
there.
get corrected here. All right, moving along. We're up to public comment. If there's anybody who'd like to address the board, please step over to the podium.
A reminder, we do have our rules for public comment.
How about some good news, some good information to get you all
Sure.
grounded back? My name is Amy Duff. I'm the Executive Director of the Branch County Commission on Aging at the Burnside Center, and just wanted to let everybody know about an upcoming event that we have. Burnside will be celebrating Christmas in July next week. On Wednesday, July 30th, we are going to have an event that will be a first for us. We're going to have lunch and dinner both for an event to celebrate Christmas. At lunchtime, we're going to have a delicious menu focused around roasted turkey. And there will also be Santa will be there if you'd like to get your picture taken. We'll have lots of great music. We also have Joe Renshaw coming, who is a local favorite. He did our Christmas program last year and it went really well. So it should be some good entertainment. And then at dinner, we'll have another meal available. That one will be focused around baked ham. So it will be a delicious day out at Burnside. And we have a different set of entertainment for that. We will have Delbert Walling in front. This will be his first time coming out to Burnside to perform, but I know many of you know him as he's definitely a favorite in our community. So I'm hoping if you've been out to Burnside before, please come out and join us again. If you haven't, this would be a great time to come out and see what we have going on out there. A lot of our grant funding comes through this board and through this organization. So we'd love to see you come out and see how we put that money to good use. We also use lots of taxpayer dollars. So if you're a Branch County resident, we want to make sure that you're taking advantage of what your tax dollars are supporting. For those meals, if you are under the age of 60, it's $7. If you are 60 or up, it is a $2 suggested donation. So it's by far the best deal that you could get. So hope to see you out. And I'm going to leave some flyers up here if you have anybody that you could share them with. Thank you.
Thank you. Okay, anybody else who would like to address the board, please step forward to the podium and give us your name.
Good morning, I'm Julie Klein. I'm a resident here in Coldwater on the North Chain of Lakes, or Renworth Lake. We've had a number of different issues, but the primary one I'm here to talk to you about this morning is that I appreciate all your work. This is constructive feedback. Feel like there was a huge glitch with what happened with my daughter, and she is not able to be here today. Otherwise, she would have been. But believe, John, we talked about what was going on with our lake and the fact that my grandchild, we've traced it back as best we can. Of course, nothing's 100% positive that she grandson ended up with E. coli after the holiday, July 4th weekend, swimming in the North Channel Lakes. My concern was the direction was called the health department. Let him know. She did that. She was told the health department doesn't handle these things. She told that she could call Eagle, she could call commissioner, she could call every avenue we'd already been through. The health department doesn't handle that. You know, the Eagle website, it's stated right on the Eagle website that the local health department does handle that. The concern also comes up that that's when we found out she was passed on to Lee, I believe. I ended up speaking to Kyle because I did not like the answers she was given. So then as a mama bear, I called back and said, time out. I work within the governmental aid system also, and I know that was not the case. The mistake happened. Let's figure it out and fix it. So I called back and got the runaround again. But I ended up finally with Kyle. And Kyle apologized profusely, Kyle Moore, that shouldn't have happened. I believe, Joe, I tried to get a hold of you, but you were on vacation, like it's summer, that's going to be expected. But it's all very frustrating that this is how this situation is handled because a lot of people are enjoying those lakes. And E. coli isn't something to mess with. Luckily, my grandson is not permanently damaged as far as we know. He's getting better. He's been put on antibiotics. But other kids may not have had that same outcome. You know, immunocompromised adults and children may not have had that same outcome. And I think it needs to be looked at, the system that we have in place, the process needs to be tweaked or training maybe to happen. I do have some additional concerns that with all this being said, and I know budgets, I've worked within the system, like I said, so I know budgets are cut, budgets are tight, it's ugly, I get it. We're all navigating it. But when the system hasn't tested these lake waters since 2004, it's scary. It needs to be tested. We've got a water septic sewage system that is being cleaned. The water is being cleaned. We know that. But it's being dumped back into South Lake on the North Channel Lakes. We've got all these new, these new farms, solar farms. The water should be tested. That's something we should look at. There's no reason it shouldn't be.
Thanks. Somebody else like to address the board?
I'm elsewhere for a resident of Coldwater Township on Messenger Lake. And we put in, my wife and I put in close to $60,000 worth of lakefront improvement. And one of those things we put in was a beach area for our great grandchildren. Julie back here, we just addressed, was our oldest daughter. And now we can't use them. For the last 5 years, we haven't been able to use that beachfront area because of the goose problem. And in 1970 and 71, I was in charge of the beach area a quarter mile south of us at Memorial Park Beach. When we were there at that time, we had to submit a weekly water sample, and we at that time had to send it to Michigan State. And just about every time we did that, they would send back a notice we would have to close the beach for swimming because of excessive fecal choline or fecal, I can't think about it, but fecal matter, too much fecal matter in the water from the geese who rested on their shoreline. And we have a lot more geese there now than we did at that time. So we need to have somebody test that water, find out why, and possibly do something about the goose problem itself, because we got way too many. I have run as many as 38 off our front lawn at one time this summer, several times. And when we contacted, or no, my wife contacted I guess the department, that's in charge of that. She was told that we can't do anything about it. We cannot kill those geese. We cannot do anything about it at all. The best thing you can do is go out in February and tear apart the nest that they have on the nearby islands. So we're not getting much help from the state, in fact, none at all. My wife can tell you a little bit more about that. Thank you.
All right, anyone else that would like to address this?
I'm the wife.
All right, somehow I knew you were coming up.
That's why. I've had lots of conversations with the state. My big question right now is who and how often on the monitoring of the lakes? Could somebody answer that? According to Melanie or whatever her name was at the state level, the health department is where I should go. So that's why you got me. So who's monitoring it? How often is it monitored?
So typically we don't go like have a conversation back and forth during public comment. But this, I think, is probably something that was going to come up, or at least this question. So you stick around, probably discuss a little bit further.
Okay. Also in talking, the gentleman who talked to me about the geese and going out to the island said, you didn't hear it from me, but that's the only thing you can do. He said that they did go out and just destroy nests and eggs on Coldwater. And I said, okay, but why can't you do it on the North Chain of Lakes? Well, they had people complain, didn't hurt. I said, okay, so a child, and I said, is that the fecal matter from the geese? Very, very lethal for little people. And of course, these kids are 1.5, 3, 5. Well, yes. I said, it isn't safe for us to let the kids out of the backyard because of all the food. And, and then it's on the beach. So, we're asking for help. I guess we pay our taxes. Hopefully you people can do something to help us because those little kids, that's the reason a lot of grandparents live on a lake is because of the kids. So we would appreciate, but I would like to know how often, who else do we go to? We've gone to the state health, the state DNR, and we're relegating. First we're told to go to your commissioners, and John can tell you, I was there. And thanks to John, you got me here. So, because he said to be here right there this morning. So any help would be greatly appreciated, whatever we need to do. Thank you.
All right, anybody else that would like to address the board? Okay. All right, move along on our agenda. We're up to the MERS Defined Benefit Actuarial Study.
That's just gonna wake you up in the morning.
Yeah.
Oh. Thank you so much for having me. In your packets, I am the next section. We'll start on page 6 of the report, and we'll kind of go through that. But before I begin, I know I come every year and we talk through this report really quick, but is there any pressing questions that I should be aware of? So as we flow through it, I can address those.
Any questions?
Or you can save them till we're to that point. You tell me.
When's the last time you guys updated the mortality table that you're using?
Yep, so it's the most recent public sector tables. It's the only ones that are currently available at this time. So
I have a problem with you. I think public sector tables are extremely outdated. You need to get to the industry average standard, which is not public sector. Sorry.
Yeah, no, I understand that. We're using what is currently available for us. You remember in the past, it was always private sector tables that we had to then modify to try to reflect public sector tables. So with the last experience study was the first time that we've ever had those. And so now that we have those, we just completed our experience study. So that was covering the last 5 years. And based on that and the fact that we were aggressive at the last time with the experience tables and the at the last experience study with those tables, we are now at generational, gender specific mortality tables, which based on everything that we're seeing now is still very current and applicable to the population that is
But if you would like to talk to any of our actuarial staff, I could certainly put you in contact with Gabriel or Smith. I'm not trying to push out. I truly, That's-
You just understand.
I
That's
understand your
discrepancy with-
feeling. Sure. And with that said, as I mentioned, the experience study, and I know in the last experience study that was a lot more impactful to the numbers this last time because of the fact that we moved to the generational life expectancy tables that were now available. Plus we looked at those dedicated gains. So we've been moving that assumption based on the returns and everything like that. There was no change to the assumptions. Other than a few minor changes, mostly to plans that the most impactful was to plans that had a frozen plan, based on when people would start drawing that frozen plan. That was the most impactful. A lot of things stayed the same, so your numbers are not going to look a lot different than what we expected from last year to this year, which can be good from a prediction perspective. So starting on page 6, were there any more questions? Okay. Starting on page 6. You move from, you can see the funding level from 2023 to 2024, moved from 92% funded to 93% funded. That's great news based on the contributions, the additional contributions you've put in, especially since we're still smoothing out the loss of 2022, so most plans went down. You can also look at the next page and find that your contribution structure again moved from the 647 to 718. 860. That's the minimum required dues starting in January of 2026. Again, that's always the minimum. You have not done the minimum for a while. You've done more than the minimum for a while. And I know we've run some numbers for you on what that looks like with that surplus division, but we'll just kind of go through the table as we are. Again, we'll talk about the assumption and method changes that are on the bottom of page 8, as I mentioned. The major contributors didn't change that much. So if you go to page 9, we move to the smoothing that we always talk about. So again, remember in 2022, no one wants to remember, but in 2022, that return across the nation, the average was in these types of plans was around negative 15, 16%. MERS lost a little more than 10%. So when you assume at that time a 7% and a loss of 10%, that's a gap of 17%. And so we smooth that loss out over 5 years, right? So that's looking at about a little over 3.5% that you're spreading out for the next few years. The next year rebounded as often investment markets do. So in 2023, there was a positive 10 that kind of when that 6.93 to 10, that gives you that kind of staved off that first year. So you didn't feel that a lot. Last year, the return, so you can see it there was the 7.28%. When you're looking at that, that's closer to the actual assumption of 6.93. So there was nothing to kind of offset that negative 3.5% that you were going to feel. So you can see the smooth rate of return for 2024 was 3.79, while the actual market return was 7.28. So knowing that you had that loss in 22, 23, 24, so you have 2 more years of smoothing that loss. So we can hope for this year, but I'm not making any kind of statements for the market this year, not even day to day. Right? So that's where we are on that. Any questions on the smoothing? Moving on to the next page. Actually, let's skip over to the following page. So page 11, you can kind of look at what we forecast down. Remember, I said you were 93% funded, and there it shows you at 75% funded at the top of that chart. The reason for that is that most of those assets are into the surplus division. So these are the assets that are just in the plan. So it's calculating your bill based on 75% funded for strategy reasons. So you'll see your required contributions starting in January of 2026 will be that 718,860. And you'll see your funding level move down for the next few years and then start moving back up. That's in direct response to that smoothing that rate out and then starting to pick that back up. You'll see those rates going up. However, as you know, you have quite a bit in surplus. And so that's something that you are looking at different options of how to utilize that surplus plan. When you go to page 13, you'll see those 2 graphs. So you'll see the solid blue line. So thank you for making copies in color. I appreciate that. I remember the year that we we had black and white, now it's ugly, so thank you, Teresa. But we've got the solid blue line is where you would be funded if you had only been paying the minimum. So that's again at 75% funded. You can see the dotted blue line above it that's much closer. That's at 93% funded. That is showing where you are funded today based on those additional contributions into the surplus division. So you'll see you're hovering right at about that 100% funding level. That's assuming that you don't put in any more additional contributions in and that the market returns a 6.93. So that's that top graph. The second graph, the graph below it, or the second graph, is showing the contributions, again, without the surplus division assets. So you'll see that that contribution is going to continue to climb and hover and kind of end up around 2034, 2035 at $1 million. But again, you've offset that with your surplus division. So it's just that decision on how you want to utilize those assets and when. Do you want me to finish going through the report at this point, or do we want to go through the report on how to use the surplus division assets at this time, since we're kind of in that subject? It's up to you. Is it easier to just go through the full report and then go to the other?
I would say so.
Okay, sounds great. All right. Table 1 breaks down that bill for you. As you can see, the normal cost for those in that division is 12.35% of payroll. The employees pay 3%. That moves you to the remainder for the normal costs. So if you were 100% funded today with all the assets out of the surplus and into the division, your normal cost would be $68,868. Because we have that unfunded liability, we're not counting on the surplus division. We add the additional unfunded accrued liability payment of $649.9, gets you to that computed rate of $718,860. That's kind of the breakdown of the math there. Table 2 shows you the benefits that were offered. Table 3 shows the number of employees. So sorry, I'm on page 16 if I'm going too fast. Sorry. This is kind of an overview, so if you want me to slow down, let me know. But active employees, you move from 17 in 2023 to 14 in 2024. 16 vested former, meaning they're people who draw the plan eventually, they're just not age eligible yet. And then you have 85 retirees currently drawn and beneficiaries drawn out. So again, a very mature plan. Most of the plan is drawing at this point versus the Table 4 is something that you turn into your auditors. That's that market value. So no smoothing of those assets. It's truly what's in the market currently as of December 31st of 2024. And table 5 is that cash flow. For those of you who have heard me year after year, this is my favorite table because it just shows you exactly where the money is coming from and going to. So you can see the employer contribution, the required was $548,781. You put in an additional $412,928. The employees put in almost $30,000. The investments made up over $715,000. What went out the door from benefit payments was a little over 1.2 million. And so you can kind of see where that asset balance moved up because you had a positive cash flow. And then table 6 is kind of the last table that we go through at a high level, and that is showing the total liabilities again for your actives is the 4.7 million, vested formers the 1.6 million, retiree beneficiaries is the 14 million over their entire lifetimes, giving you the total liability of 20,488,000 with the assets of 19,125. So if you do the math there, that's where we get that 93.3% funded with you, and you can see that surplus division. You currently have about 3.8 million in there, leaving you with the unfunded accrued liability of the 1.36. Wrapping up with check. That kind of concludes that overview before we go into kind of discussion and the other pieces. But before I do that, any questions from me?
questions? You're good.
Right. Did you want me to go over the supplemental valuation that's attached afterwards? I believe it's attached afterwards.
I don't think I put it.
Oh, you didn't put it in there. Never mind. Oh, yeah, yeah.
Yeah.
Thank you, Teresa.
I did not.
Yeah, it's flipped on my screen, so I'm just rolling along. You realize what I just did. Sorry about that. And this is based on the 2023 valuation that we'll look at, because it was requested last year, with getting a different update now that the 24 is out. So this came into the internal actuary, so they'll update these numbers. But based on the assumptions not changing and not really large swings, I don't anticipating the picture overall being much different. So I think the numbers are applicable to review and look at.
Printers never as fast as we want.
Of course,
Even though they're faster than.
they are so much faster,
It could have jammed up, yeah, we could, yeah. Could be other name.
but it's faster than me drawing it. So I'm just going to share that with you.
I mean, it's a nice whiteboard too.
No, you do. You have quite a lot
Yeah.
for all the classroom learning stuff. It's great. Roughly it is.
I didn't print this on the top.
No stress. So we were asked to look at what if we wanted to find a kind of level amount that could be budgeted for the next several years so that it wasn't this up and down conversation. You have a lot of surplus. How would we utilize that? So we looked at keeping the contributions at about 580,000, which would be a little bit less than what you would have to budget for this year at that 718. Moving 2.370 out of your surplus division, leaving about, based on the 24 valuation, 1.4 still in there. So you still have a cushion from that perspective for market volatility, which is important in the market, I think, that we're facing for the next few years. And so by doing that, you can kind of see that we can hit that 5.8 and still leave. So the idea behind these numbers is showing, especially on the graph on your right, is showing you that you will pay that 580 again, and you'll still have that surplus of about 1.4. Again, if the market fluctuates, that's going to look a little bit differently, but you'll have enough of a cushion where you could budget that for the next several years and feel pretty confident in that. Again, we'll get updated numbers, but that's generally what this is showing. And if you want those numbers to be a different budget point that you're going for, or using more or less surplus dollars before they start work on that, certainly.
I guess what I would rather see, Marnie, is I don't
Yeah.
want to move the lump sum. I just want to look at moving. Okay, so if we peg it at 580, or even if we say 600,000.
Yeah.
Then we're only moving the extra needed each year out of the surplus.
And so Teresa requested for that. And so the numbers will be run for both those scenarios. This is a repeat. And then also, what does it look like if you just draw it from the surplus each year? That's a little bit more volatile, right? But like same idea to show what that would do.
I don't think that's any more volatile than moving the lump sum, because it's all invested in a merged fund,
Sure.
you know, so. And
And it's all predictions. We don't know exactly what's going to happen each year. So for sure. Absolutely. So we're going to request that. I just want to confirm that
Yeah.
580 makes sense to you still, or
well, and again, doing it that way, my question then would be is how long will that surplus last?
Yeah.
Make that contribution.
the expectation with the extra 1.4 is beyond the time needed.
Can I ask a question?
Yeah.
So we've got a surplus in the other fund. Are they invested differently?
No, they're exactly the
They're
same.
invested the exact same. So there's no different risk to that money, whether you leave it in the surplus or you move it over. It's the risk is there. And you know, and you talked I think you said in 2022, the MERS saw a 10% drop, but you were anticipating a 7% increase in the market, right?
Our assumption is 6.93 for each year. Yes,
So let's
7%.
say
Yeah,
7%.
I thought you meant an increase above the 10.
No.
Sorry, I was like, what?
No, you
Sure,
okay. And then you said in 23 you saw a what percent increase?
positive, over 10.
Over 10. Okay. But in simple math, if I had $1 million and I lost 10% one year and I gained 10% the next year, I'm still behind.
You are-
Because
Yeah,
because
you assumed a 7, so. you
I'm
actually
still
get the
behind.
7. For sure.
Because I'm still behind
Absolutely.
where I was to start the year before. Because if I had $1 million, I lose 10%, I lose 100,000.
Gains.
I gain 10% the next year, I only gain back 90,000.
Yep.
I'm still behind where I was.
So I will share, and I'd have to see if there's another way we can do it, but currently the standard is for us to move the lump sum over so that we can kind of do that bill. And so that's how the numbers are usually run. The other way would depend on you doing a lot more math, right? So we can give you a forecast, but each year we're probably not, it's going to be hard pressed to say, okay, and each year we want you to recalculate this MERS. They're going to say, why, when we can do something like this that takes a lot of manpower and things like that. So I would say, if the numbers show out to be about the same, this is the least administratively intensive. However, I have groups that literally say, okay, tell me what the bill is. I know my budget's 580 and I'm just going to draw from this to that. And that's you administering it versus MERS. So it's really a choice of the health department administering it or MERS doing that piece of it. And we're fine with either. So we've absolutely done that for both groups. I'm just saying from MERS changing your bill, you would have to do that piece of the drawdown from surplus.
What's your concern about the lump sum, Commissioner Lecter?
You know, we're basing this based on, too high of a rate of return, too long of or too different of a maybe true mortality table. I still have some concerns with MERS calculation. And to me, there's easy calculators out there as to how long will my money last. You know, how long will that last to supplement that additional?
Based on the assumptions you put in and things like that, I thought that, and again, I'm not arguing for either point because we can do it either way. I mean, for us, it's completely up to you from an administrative perspective. I will share that you're still going to have about 1.4 in surplus in case that's not being moved into the lump sum to kind of give you that cushion to the point of the assumptions. The assumptions are the assumptions. They're not going to be exactly perfect. To your point, absolutely not. There could be something else that changes those life expectancy tables. There could be something that changes in the marketplace tomorrow. Not whatever, but whatever I have to do. I don't know if you throw salt over your shoulder. I don't know, but something. I didn't mean that to say that out loud. But the point is still that you do have that piece. So if it feels administratively challenging from a budget perspective and keeping spreadsheets and doing things like that, we can certainly do more of this type of thing for you. But MERS doesn't need to administrate this for you. You absolutely have tools to do that. So that's completely your call from an administrative and board perspective. We'll just give you the numbers and how they interact. But both of the numbers we give you, regardless of which scenario we do, is going to use the same life expectancy tables and the same things. And so
That's why I was going to say that as well, right? I mean, projected potential gain in the market and all that kind of sort of investment gain, I should say 6.9%. And the mortality tables doesn't change because we move money from one location to another, right? I mean, all that's the same.
correct.
So I don't know what that means for the
I guess.
but
What's your fee for management?
Fee for managing this is part of your administrative thing. So it wouldn't be an additional fee for that.
Okay, but what do we pay MERS for managing them?
I can pull up that don't know why it's not popping right in my head, because it usually does, but
Teresa, do you have something to say about that? You look like you were gonna.
Oh, I did have a comment I would like to make, and that's whether we move a lump sum or not. Because both funds, the surplus and the regular, are both invested exactly the same, the math is still the same. It's still, whether we move it a little bit at a time
I agree.
or make the one lump sum, the 580 plus the drawing it down, how we move the money doesn't change the math of the 580.
But
Yeah.
my comment though is, we've got what, $19 million in valuation assets with MERS.
3.8, sorry.
How much money do we have with MERS?
Oh, the total assets, sorry, I don't have that
Yeah,
up. I'm pulling up that answer to your question.
19.1.
No, total market value, is that what you want to talk about,
Yeah,
or smooth value?
Valuation assets.
We're gonna run numbers on market value, but it's that 19.1 of smooth value. But again, market value, because we're still smoothing out that loss, is that pay table before, which is 17.952.
And so your fee for funds under management, 0.5% annually?
It's usually less, I'm trying to pull that up for you.
My point is we're paying you enough. Your actuarials can do that calculation for us and do that administration. It's my thought.
So you want us to tell you what you're supposed to pull up the surplus versus just putting it in and doing it systematically?
You know, yeah.
Because then
Every
it
year?
becomes a manual
Is that what you're saying?
process
Yeah.
instead of a,
You know, again, that fee for service, to me, that's more than enough.
I can ask. It's not my call. It's definitely not my call. The standard and why it's there is because we get a lot of actuarial requests for people moving and changing and negotiating and doing things like that. And we try to keep our fees lower, and we discount what you put in from an actuarial perspective to GRS by significant amount. So we're trying to keep those costs low for everyone. So they have policies to do that and keep that in place. I can certainly ask. But I can't give you that answer today. I apologize.
And the other reason, I would rather move some, if we're gonna move it yearly as opposed to lump sum, is we still have in place a policy that requires us to continue to contribute to that surplus fund.
Mhm.
You know, so that surplus fund, you know, is gonna continue to grow because we have to continue to contribute to it. And, you know, we're making that contribution. To me, it's easier to make it yearly back to the base fund than just a lump sum.
Okay, so you'll check on that.
Sure.
Yeah.
Absolutely.
I guess my only point with all this would be how it affects staff and what they have to do. I mean, if it creates more work to do it annually or the one lump sum. I mean, I would say that we do the lump sum if it's easier on our departmental staff. So
Necessarily, I did not understand that it was a lump sum payment when I brought it to you first. My anticipation was we were gonna do it annually based on, this is what they give us a number every year. It's very clear in the report how much that number is. And I mean, I can do simple math and say, okay, 580 minus this. It's not a heavy lift for me to do it annually.
Yeah.
And to pull those funds out of it.
Yeah, and the nice thing is, and I know the numbers are not exact, but you do forecast what those numbers are going to be for the next 5 years.
Yep.
You know, if we went back and looked at last year's MERS report, the number that they forecast for 2026 was actually higher than what they're telling us here we had to contribute for 2026. By about what, $10,000-$12,000? But it was a little bit higher. So
sure.
we have that number roughly so we can budget at least the next 5 years and say, okay, if we're going to do this, then we're going to be drawing down this amount out of that surplus fund each of the next 5 years.
And like I said, to your point, it's Excel. Like I have a group that does it and they show me their Excel and I'm like, I can't verify or deny your numbers, but absolutely, because I'm not allowed to do that obviously, but that's absolutely something that we can do. Some people feel that this is a little easier, but it's easier in the eyes of the beholder, right? So we don't have a preference. We're going to be running numbers to show you if there is any significant difference between the two scenarios. So you have an idea from an actuarial, but again, they're going to use the exact same assumptions. So, but absolutely we'll run those numbers. Is 580 still the number we're looking at? Feel like? Okay.
I feel like 580 is a good number. And my preference would be to do it a little at a time, not the one lump sum, because I think it allows for more flexibility as market conditions change, and we have no idea what that's means. So
Sure.
it allows us to reassess from an agency standpoint, every month.
Alrighty. Anything else for me?
I don't think so. Any other questions, comments, anybody?
I appreciate your time.
All right, thanks for being here.
Thank
Appreciate
you.
it.
Thank you, Barney.
Thank you.
All right, so we're gonna move on to the health officer's report.
Good morning.
John, were you asking if we need to have a motion to accept the merger?
Oh, we do. Do
I'm
we,
not
do we have
objecting.
to take action on that?
It's not asterisk, so I'm not clear if we need to have a push up to them.
To me, it doesn't seem like something we would. Okay. We'll move on. Back to-
Okay, all right, so my report starts off with our workforce development plan, which was provided today later in the agenda. This is plan update. It provides us the opportunity to take a look at our staff, identify challenges for the future, shares results of competency assessments of our staff, and then identifies training curriculum and a schedule for that for the folks that work for the health department. So this updates our goals through 2026, and it is part of the accreditation materials that demonstrate we're using best practices with our team to ensure that they meet those minimum core competency knowledge pieces. So that will be later in the agenda today. So moving on to the budget updates, I did want to notify you, last month we talked about the original budget and approved that. And at that time, the HIV grant funds had been eliminated in the original budget numbers we were given. Since we did all that and passed the original budget, we have now been awarded the HIV grant and at the same amount as the current fiscal year. So as we've already talked about and especially mentioned last month, we're going to be doing a budget amendment early this year, and that will take into account any fluctuations in grant funds. So. The annual employee satisfaction survey has been completed. It was reviewed or shared with the Program Policy and Appeals Committee. It's included for you. The first 3 pages provide a summary and comparison from the previous year. That is also on the agenda later, so that's what we'll say, I guess, at this time. We did do a request for bids for exterior work on the building in Hillsdale. Those bids were due July 15th. We had 2 bidders that submitted, and those were reviewed by the Finance Committee at the July 21st meeting, or Monday. They did make a recommendation for one of the bids, and that is also later on the agenda. Wanted to inform you of a House budget item that puts our hearing and vision and COA programs and some concern about the future. So the funding for these programs is in what's called categorical funding in the school aid budget. The House has proposed that those funds that were in categorical be moved into the per pupil funding. By moving it into the per pupil funding, then those categorical funds aren't available for direct grant to the local health department, for example, for a hearing and vision program. It does increase the per pupil funding amount, that's as we'll get, but it eliminates that direct funding of hearing and vision and COA. So these are vital public health programs. They identify children that have certain conditions that create learning delays. And the hearing and vision program, I give you some numbers there that are statewide, screen around 1 million children each year, with 85,000 of those 1 million children being referred for further care. The oral health assessment is obviously still pretty new in the state. And these numbers as of October of 2024, the entire state wasn't operating program at that time, but there were 18,000 children that have been screened, with 1 in 4 referred for urgent dental care. So important programs that ensure that deficits in children are identified early and corrections are made to allow them the best opportunity at a future. So,
To go, just a quick question for that point. You'd have to go to the local school districts then and ask that those programs to be.
Yeah, it'd be at their discretion then.
it would be at their discretion. And yes, we would be in front of school boards, asking for funding to do these programs. And should they choose no, hearing and vision is an essential local public health service, so it's required or mandated by the local health department to do those programs in the public health code. We have asked MDHHS, what happens if we aren't funded?
Right.
And, you know, do you have funding to replace this? And MDHHS has told us that they do not. I'm sorry.
Yeah, to me, that never should have been funded through the school aid fund. School aid funds for education. And if that's a local health issue, it should be funded through the HHS budget.
Understood. I wanted to let you know that this is how the current House budget looks. Should the categorical funding be eliminated and put into the per pupil, we would be forced to go to each school district and ask for an allocation from their per pupil funding to do these programs. I think, obviously, as you can imagine, the amount of time that would take, the number of school districts that we have is significant. And it really just puts these programs in jeopardy of us not being able to continue them.
No, we would have to continue them because they're mandated underneath the essential.
And I don't know how it would fund them. So.
Something tells me that there's a lot to happen yet with the budget before it's.
Oh, yes, and we know that, right? So it's early and it looks like, you know, the budget could take us right through the end of September. I hope not, but it could this year. So, I did want to let you know
I
what,
think you're being optimistic.
So probably right about that actually too, yeah.
so this, yeah. I like to try to be positive. So here at Branch Hillsdale St. Joe, we have 2 full-time hearing and vision technicians and 1 part-time. And that's what they do. They come and work and do hearing and vision screenings.
But they're full-time during the school year. They're
During the school year,
they
they are
don't work
laid,
right now
they are laid off during
during the summer.
June, July,
Midday.
2.5 months. So 3 months, about 3 months, yeah.
The part-time person this year.
So the 2 full-times. We have 1 full-time children's special health care representative. So that person is mostly dedicated to supporting CSHCS, but that person is also trained and can provide hearing and vision screenings. And so there's a little bit of that representative's time in screenings as backup. And then regarding COA, the dental hygienist, we have 1 on contract. There is some supervision time, of course, with our supervisor for CSHCS and COA. So I just wanted to give you a picture of what this looks like. You know, we are hoping that the legislature will put this back in as categorical funding. And that's all I have to say about it, I guess. So the federal budget for 2026, at this time, we have received, other than the hearing and vision adjustment, the numbers we've been given for original budget are the same at this time. So if there's anything changes, we, of course, share that with you. We have a few positions we're seeking right now. The AAA RN care consultant, I don't know, Laura's got an update on that.
We do, August 11th.
So we've got somebody great. We have a part-time clinical clerk position open in our careers office and a part-time community health worker open also out of the St. Joseph County. Public health concerns, I wanted to give you the most up-to-date arbovirus information, so that is included in your packet today. And then I do want to talk for just a minute about surface water issues. So in our jurisdiction in 2004, we did have the beach water grant from the state to do beach water sampling of inland lakes. So only public beaches were sampled in 2004 when we operated that program. I was one of the staff that was part of that at that time. So we only did it for 1 year. The grant funding was really not enough to cover the program costs associated with doing that sampling work and the staff time and everything else that was needed. So when it came back in 2005, the decision was made not to go after that grant again because it needed significant infusion of revenue dollars, which we didn't have, to prop that program. The state, Eagle, has a strategy for reviewing surface water in Michigan that's kind of on a 5-year schedule. So they break it up by watershed. So the watershed for the north part of Hillsdale through Branch and St. Joe is part of the St. Joseph River watershed. That watershed, I think it's this year and maybe last year, were due for their 5-year cycle of the type of testing and stuff that they do. They do E. coli testing when they do that. They do a lot of other things. They look at macroinvertebrates and all the life of that watershed. So there is some state testing that happens on a 5-year basis, but it's usually just a few samples. It's not like what we had to do for our beach water grant, which was go out there every week and collect 3 samples on the beach and then have those analyzed. Yeah. And then we looked at the mean, median, and I can't remember the term at the moment. But anyway, it's very different than what we were doing with beach water sampling. We do have areas of the St. Joseph River which have are identified as concerns for the St. Joseph County watershed, I should say. And it is because of all of the different influences: agriculture, wildlife. To some extent, well, I'm sure there are failed septic systems that we don't know of that also influence that. When environmental health does get calls about concerns of surface water, we like to talk with people about every time there's a rain event, a heavy rain event, or any rain for that matter, all that rain does is wash everything into the watershed. And that's a good thing, right? We want that rain to clean and move things through. But all the goose, all the other wildlife, all the animal agricultural waste, any septic systems that are failed that we don't know about, all of that gets washed into that surface water. And it elevates those numbers. And we were able to demonstrate that with our surface water sample. When we would go out and take samples after a rain event, guess what? We had elevated E. coli numbers usually. So all that to say, if there is knowledge of a citizen about a failed septic system, we want to know so that we can further investigate and determine if that septic system is indeed pushing human to the watershed. So please contact our office and let us know so that we can follow up with that property and make some determinations about whether or not it's failed, and then move forward if it's necessary with correction.
So this seems there's multiple factors at play with this issue, I think. Yeah, I mean, we're talking about, and I think the issue also is there's multiple agencies, right, that have kind of oversight over all of that factors, right? So yes, the health department has a role to play with this, right? If there is a failed septic system or something like that. Who would be the other agencies that would be in touch? And do you know, like, if it's the wildlife issue, for example?
That would be DNR.
Right.
And then MDARD with agriculture, if there's a concern about how agricultural waste is being applied or, you know, using general management practices,
You know, the individuals mentioned something about discharge from a treatment facility. That is strictly governed by by Eagle.
Yeah.
You know, and even, you know, so looking here briefly at Eagle site, they have a, you know, quick who to contact. Well, if it's lake testing, water lake testing a lake, it's the district office. But a different spot, it says if it's bacterial contamination, local health department.
Right.
So,
So they don't know. But the just normal citizen doesn't know what it is, right?
the bottom line is that surface waters really are not being tested for bacteria. They really aren't. There's some PFAS testing going on now. That's right. The new issue of concern, and I'm not saying it's not, but it seems to be the hot issue right now. So they're doing some surface water testing with PFAS, but there's just no statewide strategy to do surface water testing anywhere. Lake associations often take this on themselves.
Sure.
They'll take it on at their cost because it's important to them. And, you know, of course, we applaud lake associations that can do that. But yeah, it's a mismatch.
So the monitoring, it sounds like, probably needs to occur with the lake association. And then the responsibility to address the concern that they find is going to depend on what is identified, right?
you know,
Because there could be a health department responsibility there, could be DNR, could be, you know, Eagle, whoever, right?
so the health department, you know, you hear all the time, you know, the ban on swimming in this lake because of, you know,
Yes,
why.
we do hear that all the time, yeah.
So I believe last year, the year before, actually did that for some algae
Oh, sure, absolutely.
infested areas.
Yep.
And I forget what lake.
So much like our
Right, Diane?
commission meeting, when we talked about this, at the Branch County Commission meeting, I think the answer that we kept coming back to, I feel like is for people to go back to their lake associations. And either get involved with them. And to encourage the testing to happen like it probably needs to happen to identify these concerns. I mean, join the board, I guess, too. They're often looking for members to join these boards, so.
And that is the ideal, but a lot of times it comes right down to the homeowner's reluctance to flood down. So it's educated, but it does come back down.
Right.
Even though the cold water came in that disrupted the geese and the nest of the eggs association, the lake association. When there was actually an article that the water paper ran on. But the guy, I did know the guy that was part of that. I don't know if it's his son, but he did take a lot of geese eggs out, I guess.
And I'm not one that's overproducing. I don't know.
September.
I don't think you can shoot them on the water though.
Well, get out somewhere where you can then.
Pretty much anybody's yard.
I have just a couple of.
Yep.
That's all right. So I did include today in the Beacon Health System Community Benefit Report for 2024. Beacon is the hospital that is in Three Rivers, and they're a large health system. So they purchased Three Rivers 2 years ago, maybe. And so you will see in the report that's included in your packet that we are spotlighted on page 15 of their report from Breastfeeding Mom. we do have, grant funds that we utilize with Beacon. We had grant funds last year, we applied for another grant this year, and, Chris works a lot actually with making those things happen along with pipe steps. Beacon is a wonderful community supporter. Finally, you'll see the actual sign if you came in today. It's actually up and done. Yay. And I gave you a photo there of it. We are expecting the counters to be replaced and updated and buildings here before the end of August. That's what we heard, Heidi and I, when we went to the meeting with the contractor over there at the annex building. So we're really looking forward to that project moving along. Of course, we talked about the bid for the physical exterior today. The carpet is done and for years. It's great, lots of good comments from staff. And finally, my evaluation is scheduled to be conducted in September. So I am requesting that be done in closed session. And after the August meeting, you'll be provided with the evaluation tool from Teresa. You'll get that in your email. That's it for me.
All right, questions for Becca?
Back to this water quality issue then, so on the cold water chain of line, did we test, find E. coli, issue a swimming advisory that?
In 2004?
In 2004.
Oh, no, I'm talking here with this most recent issue that was brought forward.
It is. That was on actually Norwich.
Yes.
Two different things.
Which may not have.
Right, and that kind of goes back to the point about there's nobody doing like actual testing on a routine basis. Right? So,
And we did do testing. We did Messenger Beach,
Quincy,
the one that's south of Quincy. If you go into Quincy, we're
across from McDonald's, back in their Longset Cemetery, we did that one.
Isn't there just two in Grant County? Yeah, those are the only public beaches that we were able to find at the time. So ones where we had access, right?
I mean, did any, so this was a grant from the state? There was no like program that came out of that then afterwards, like, you know, like, hey, we need to implement this now because we found this issue and all that kind of stuff.
Well, I mean, there just isn't funding to support the program. That's really the issue. Could we have a program? Certainly. There's just, you know, we can apply for the state grant, but it's just not enough.
Sure.
Because to take that money means we're paying somebody to derive. And then the other issue we have is with the analysis. So we lost the ability to use a courier, a medical courier that used to come through our area fairly routinely, like daily. And they would pick up and they would take them for us. We lost the courier. Business model isn't there anymore for the couriers to exist. That didn't be before COVID. So no courier, our staff would not only have had to drive around the counties taking samples, but then they'd also have to drive up to the state lab in Lansing. And there's a 6-hour window in which the sample has to be run. There are some new technologies now that may allow us to do sampling in-house, but still we have a lot of staff costs associated with a program that only addresses public beaches. And as you all know, that chain of lakes is huge.
Right.
We'd only be sampling.
Well, this goes well beyond just the public beaches.
And what good, that was my point, gonna be my point, was what good's it gonna do to do Messenger Beach and the beach in Quincy when you have, 4 lakes on the north chain and 6 or 8 lakes? And with E. coli, it can be here, but not here 100 feet away.
Well, if you think,
So to actually be able to test and get a good test, because I would imagine when they test like Lake Michigan on them beaches, I would imagine they're going probably every 50 feet or something and taking a sample.
Well, I'm really not sure. When we were.
I mean,
doing-
I'm guessing,
Yeah,
I have a water and sewer license,
yeah.
and so,
Right.
I mean,
When I did it, I went out like mid-thigh depth. And then we still have the poles. I think those are 6 feet, the little dipper poles. And I dip it out, bring back, cap in, and then.
Yep.
So
And the sample was 1 foot below the surface?
1 foot, yes.
Yeah.
If I remember right.
Yeah.
And water depth matters, because then the temperature changes. Like, well, I like certain temperature. So what do people like to do? They like to go in the shallows, right? That's where it's fun to play.
And the sun kills it. So the more, sunshine that there is on the lake, that will, eliminate some of that bacteria.
more
naturally.
algae that's in the lake.
But,
Keeps you going.
I mean, the watershed is huge. I mean, it's huge.
It is a huge one.
And if I could clarify, the only notifications that we put out as an agency are regarding harmful algal blooms. We, in my time here anyways, we've never closed a beach for E. coli.
Right.
We are notified of harmful algal bloom positivity, and that testing has typically been done by Eagle. And then we get results and we post signage
Right.
and issue the press release. So that's how the harmful algal bloom piece works. We've not posed anything due to E. coli since I've been here.
Thanks, Chris.
All right, we'll move along.
Good morning. My report is in the packet. Slightly different things this month. We did some fit testing for masks for our staff. So there were some applications and then we went through this little 5-minute process. That was actually kind of cool. Showed if salt particles got into your mask when you did certain activities, and then we fit everybody for a mask if we ever needed that. And then we had to change some of our latent tuberculosis treatment plans because one of the medications is a shortage. So we've kind of done well with that. I went up to St. Joe on Monday to see one of those patients, and I said that I eat about half of English muffin bread on my way home from Yoder. So, that really it's not so good for my. But Yoder's is amazing. And then my report. So about 10 days ago, I felt like the news was just flooded with all of this nicotine poisoning in babies and toddlers. And it was because a study had come out in the American Academy of Pediatric Journal about nicotine poisoning. And it makes me think of vapes and cigarettes and chew and all these other things. And I had really not heard very much about this ZYN packet. So from 2010 to 2023, there were about 135,000 cases of nicotine poisoning in kids under the age of 6. And almost all of those occurred at home. And they were exposure to all of those things we've heard of, right? Chewing tobacco and regular cigarettes and vapes and the liquid that goes in the vapes, and gum and lozenges, all those things that kids might put in their mouth. And then this nicotine product, which comes in these they're little pouches, and they come in this container, which supposedly is designed to be child resistant. However, if it's left open or if a kid's pretty creative, they could get in there. These are little pouches. They have a little wrapper on them, and you stick it in between your gum and your lip, and the nicotine dissolves out of there. The packet sometimes remains a little bit, and you have to take it out and throw it away. And they have been advertised as being tobacco free, and they come in all sorts of flavors. So you can also imagine that a child who smells like something like bubblegum or mint might try even to get into that little package to see what it is. So interestingly, this tobacco free thing has kind of become a big deal in the United States, right? We all think, oh, if it's tobacco free, maybe I'll try it. But it is certainly not nicotine free. In fact, it has a lot of nicotine. So we have had a huge jump in the number of nicotine poisonings in babies and toddlers. That study actually advertised it as a 763% jump in the past 3 years. So those pouches can contain anywhere from 6 to 9 milligrams of nicotine, which we all know is a stimulant. And kids can get things like high blood pressure, high heart rate, vomiting, nausea, and coma even. And there have been 2 cases, a 1-year-old boy and a 1.5-year-old boy who died after ingesting the liquid nicotine that people use in vapes. So once again, we have something that's pretty easily accessible on the shelves, and it's actually running out. I mean, people are really using these things. They're having trouble maintaining the stock of these. And if you look, I had the money in there too. It just, so in the past decade, it was, they found the sales were 709,000 in 2016, and then it was 216 million, right? By 2020 predicted of people making a profit from these things that are harmful. So again, what can we do about it today? Well, they're not even FDA approved, but they're on the shelves. So we can start to, talk about that with our local government. And we can also use perhaps the boxes that Chris's department puts out for marijuana and products like that. We can encourage people to put that in there. A lot of these cases were very interestingly teenagers who were using these and the parents didn't even know. So, and then the little brother or sister gets in there. So those kind of conversations are really important as well. So I don't have a great solution for this, but just an awareness that I had no idea these pouches were even available. They just look like little white pouches full of nicotine product, and you put it in there. And there's even formaldehyde in there when you look at the content of the pouch. So obviously can't be very good to either milk or ingesting, and especially for a child. So again, if we can have some education and talk about it, I think that's another one of those good health department things that we can put out there, let people be aware.
All right, thanks. Questions? All right, so we'll move on to departmental report to personal health and disease prevention. Right.
Good morning. I apologize for my voice. It's been over a week, but we're recovering. Just a couple updates for measles. That's up to July 22nd. There's 1,318 across 40 jurisdictions. That's 18 confirmed cases from Michigan. Early July, Kent County did have their second case that was involved with international traveling. Lyme disease, we are seeing a lot more cases right now, which is common during this season. But the number of cases reported to date are similar to that of previous years. So I did include a couple little articles here. One is just how to steps to prevent tick bites and disease. And then an article about the Asian longhorn tick that was discovered. There were two that were found in Bering County. And then I think we have some questions on whether or not we could still send in ticks. And then they sent out some paperwork that's saying you can, and then there's instructions on how to take the picture, specific do's and don'ts, and then the website where to send that. And then I did include a lovely picture of the three most common ticks. As far as rabies, there's been 17 bats in Michigan detected. We added one to Ottawa and another one to Sanilac County. I listed the current TB and LTBI cases that we're managing. These have changed recently, so there are a couple more to add to that. Dr. Lucarello talked about the shortage of isoniazid. CDC, they do have a stockpile that they're keeping for active TB patients. So if we were to need that, we can kind of reach out and see if there's any available. June 27th was a National HIV Testing Day, which for our agency, we did 11 HIV tests in June. Something we're pretty excited about right now for WIC. Shelby, the coordinator, has been working hard to get the mobile unit prepared to take that out twice a month. On the first Thursday of the month will be at the library in Waldron. And the third Thursday will be in Midfield near City Hall. So from 9 to 3, people can stop in and get their services there. She's been working on just making sure that it has all the equipment. She even went out to make her mobile hotspot work through those locations, which it does. And then the staff is going to take it out a couple of days and drive it around just to kind of ease their mind with that as well. Children's Special Healthcare Services, 2 of our staff members attended the annual conference. They learned a lot about cleft palate care. They focused on surgical repair, feeding strategies, and some social emotional support. So they left that meeting with some tools that they felt they could use for some serious cases. Still continuing the back to school clinic. We have one going on here today in Coldwater. And then lastly, our annual client survey has been active. We started that in mid-June. We're gonna close it July 31st. Last I checked, we have about 141 responses. Also positive. But we'll look at that and see where we can make some improvements. So I will.
I know question I would have, Heidi, is, I know one of the things mentioned in the bill from Washington DC is regarding, I believe, some of the WIC that is funded through the SNAP program and maybe more cost borne for the administration of that at the local, state or local level. Have you heard anything on that?
I have not.
The notice of award that we received for FY 26 is a level funding.
Okay.
But subject to change at any time.
Well, I believe a lot of those changes were to start the end of 26, so.
Okay, any other questions? All right, move on to health education promotion.
Good morning. And where's the Joan? You have your report in your packets. We continue to work on our various programs. The Lock It Up campaign, we've distributed over 1,300 bags. That number is up since I wrote that report. Goal is to get out 2,100 and we are well on track to do that. We did complete our video series. So we currently have at the bhsj.org/lockitup site or our YouTube channel, you can find a video on THC in pregnancy, THC in driving, and THC in mental health. So hopefully folks from the community will take advantage of those interviews and that educational material. The Office of Highway Safety Planning grant is going very well. We've made some really good progress. We were informed by some community members that they have started to see some lighting in the Branch County community. And so we're excited to hear that. We've had some really nice success working with the bishops and all of them have been very open to having the conversation. So we're getting ready to wrap up this current fiscal year. And we're just waiting for the final announcement for our 2026 funding. In relationship to the community health worker, she served 30 clients last month. As Rebecca mentioned, we did receive funding for that program, which is why we have a part-time position for St. Joseph County. And so we're looking forward to working with Beacon on that funding. It is renewable, so if we continue to make good progress, we can renew for a couple more years, which is good news as well. And I think finally, the areas of concern that the community health worker continues to see, of course, continues to be issues around maintaining a home or getting out of homelessness, food insecurity, insurance. We've been doing quite a few lifeline telephone services as well. So those are the main issues the community health worker has been working on.
Okay.
Another offer. So we did present in July. The report says we presented to all 3 counties because I was expecting to be at the Branch County Road Commission meeting this morning, but that was canceled. So we rescheduled that for August. But we did present to the St. Joseph County Road Commission and the Hillsdale County Road Commission. I've been asked to present to the Hillsdale County Board of Commissioners at their September meeting. One of their September meetings. If the Branch County Commissioners or the St. Joseph County Commissioners would like us to present there, please let me know and we'll be happy to schedule that for the commission or the commissioners.
Okay, sounds good. Any questions?
We do anything educational wise at the fair?
We do not have a booth this year at any of the fairs.
All right, we'll move on to environmental health.
Good morning.
Morning.
Just want to update you on some stuff's going on in EH. We are working a ton with TFUs. So those are the food trucks that you see out and about. We're doing a lot of education. What we're finding is every state has different food codes, obviously. So a lot of these food trucks are being built out of state and folks are getting them in specifically Texas for some reason. And driving them all up here and they think, well, I bought it, it's been manufactured, it should be good to go. And we look at it and go, oh, we gotta change this and this, and they're upset. These are, I thought I knew they were pricey, but it's outrageous what people are paying, like $70,000 for these units, and they're not right. So we've had to spend a lot of time educating, which is fun. My staff's good at that, so we've been doing that. We only had just a couple new openings, a nonprofit with the Somerset United Methodist Church and the old popcorn stand in Centerville. On the well and septic side of it, wrapping up campground, swimming pools, those should be getting done here real soon. We did send out 600 surveys, and I'm going to go over that. That's not in your packet, but I do have some numbers on that I'm going to go over. And then to kind of piggyback with Heidi a little bit, in response to the Asian longhorn tick, MDHHS got with us and said, we would like to get all the ticks that you collected, and we want those mailed up. I have mailed those up. They've not given us a time frame in which they're going to identify those. We got 2023 results last month, so they're behind. Really behind. I just kind of, this is in your pack.
You got 2023 last month. You still don't have 2024 yet.
No.
And they wanted your 25 sticks.
Yes. I didn't spend a whole lot of time trying to wrap my mind around because it would broke it. I was like, man. Just kind of want to go over some other things that aren't in my board packet. The survey that we've gotten 23 results back.
And Joe, this survey went to
well and septic, people that have gotten completed well and septic permits.
Okay.
In all 3 counties. Predominantly 46% of the 23 that we've gotten are Hillsdale County residents. It's been fairly positive, I would say. We're seeing the permit application was easy to understand and complete. 52% people agreed with that. Another category was, did the health agency staff address questions and concerns? And 48% agreed with that. Another 48% agreed strongly, and only 5% disagreed. Agency staff treated me with respect and were professional in their communication. 48% were strongly agree with that. 43% agree. So it's been, there's always room to improve. Okay, and I welcome that. But it's nice to see that some of that work is being recognized as good work. And I wanted to share that with you. The other part I wanted to share with you is kind of what it looks like to get a permit. Walk you through the process a little bit. So with wells and septics, if you're doing a new construction, you come in, you apply for the permit, like you've got to bring in your tax ID number, give us a drawing. That's all submitted. If it isn't, the application isn't filled out completely, we have to wait for that information. And you have to get that to us. Some of it we can look up, like tax ID information, things like that. We go out and then we do our site visit, either doing borings or trying to look up where other people's wells and septics are to make sure we're meeting those minimum distance criteria that we have to have. And then we issue that permit to you, and then you get your contractor, if they install either the well or the septic, and we have to go out and we'll find. That's kind of very pared down for just well and septic. We're also handling complaints. So complaints are being issued and we have to go out on top of it during our busy season. Like I was just out on a complaint with staff. Actually, this complaint was valid. They were dumping sewage into I wouldn't call it a lake, I'd call it kind of a swampy area. But we had to go out and deal with that. We were with 3 sheriffs to do that. It was kind of a rough area. The other one that's kind of different is a change of use. So if, for example, I was building on my lot and I only have an acre and I'm going to put a really big pole barn on it. We work hand in hand with the building department. I would go get building permits and they say, oh, got to check with the health department. Make sure you can do that. The reason for it is whatever system you have on there that was sized for your residence when you applied, your septic, let's say you've got 600 square foot septic. you have to have another 600 square feet in reserve. Okay. If my lot, my acreage is very, very small and my pole barn's huge, that takes up that 600 square feet, we wouldn't allow it. Because you have to be able to have that reserve, because your system at some point will fail. Maybe in your lifetime, maybe in the next owner's lifetime. You don't know that. That's how you use it, and I take care of it. The other issue that we run into is someone comes in for a change of use, we go out and evaluate it, and it would prompt them to say, oh, well, you're doing an addition to your home. You need to have more square footage to your system. So on top of that change of use, we take that fund, those funds that we paid for it, apply it to a well or septic application, because you're adding on to your house, your system's got to be bigger. So that kind of draws the process out a little bit longer. It can make it longer. So I guess all that being said, I just wanted to let you know that we've done a little bit of a study about how long it's taking for this to all happen. Based on March through June, 50% of all the sanitarians' work was reviewed on completed well and septic permits. And the median time from receipt to completion of application to permit for a septic is 13.5 calendar days, and a well is 8 calendar days from the day you come in and we have a complete application and payment to you getting your permit, those 3 times. So that's pretty good. You know, there's outliers and things, but we're working hard. And I just wanted to bring that to your attention so that way you have maybe a little bit better idea of the many varied steps it takes to get from application to permit to actually a final product. So I just wanted to give that to you. And that is what I have. Environmental Hub?
Joe, have you looked at those numbers at any other time frame?
No, we haven't. We will be.
Okay.
Yep. As we progress. So we've never really done that. And so this is a new thing that we've started doing. So that's the most latest data that we have. We're going to go back and look in October and say, okay, what was July, August, September? What does that look like? So that we have those numbers for our QI product.
It'd be, thank you for doing that. You know, if you could update that, you know, even, I mean, corporately, they keep track of how long it takes, you know, where we're at on, you know, if I send paperwork to the corporate office to change something, you know, I can go every month and look at a dashboard and tell me what that time frame is for those changes. So, you know, if you, to me, you know, the less time it takes for us to issue a permit, if it's a, you know, that's, we're helping economic growth by issuing those permits faster.
That's correct. Public's got to understand we've got to have our everything we need.
Yeah, everything.
Understand that, but you know, but right, if we've got everything on a completed application and then
there's no weaknesses,
then we're still taking 13.5 days for a septic. So, and I understand, you know, we've got stuff in the queue, you know, the
complaints are drastically up across all counties, and that's additional work we have to go out and get after. That takes time, staff time to do that. And I totally understand where you're coming from, and I agree. We shouldn't be sitting on anything, right? We need to, we're providing a service, and we need to get after it. It's one of the many, many things we're trying to tackle in one given day.
All right. Any other questions, comments? All right. How about the AAA? Hi, Laura.
Good morning. Good morning. Good morning. We had a very busy third quarter and the Services to Victims of Elder Abuse program, and that report is included in my section of the packet today. As the community health worker, frequent topic areas discussed, housing and homelessness is one of our remaining, very frequently involved with a number of our victims. We've also had a number of successes with getting restitution. Crime victims compensation is a way that if somebody has been financially exploited, there's a look back period and there's a long application process to the state of Michigan. But we've been able to get some restitution for individuals, here in Branch County. That always feels good because it's been, you know, such a loss to them out of their bank account. That restitution helps put those resources back and available to them to live safely in their community. The No Wrong Door project, which is now called My Options, is still going strong. We've had our first quarter of programmatic reporting with a lot of success. We hired a part-time outreach specialist. I was going to introduce Jane. She was sitting in the front row for about the first hour of the meeting, but then I had to leave for a training. But yeah, she comes to us with a great amount of aging network experience. Actually, she works in Hillsdale County in the Medicare counseling program, so she's being refreshed in that with her training. And then we'll also be working in the person-centered options counseling, part of that project as well. There's supposed to be a statewide announcement at some point very soon. I have not heard it yet, but the state will be announcing the project and promoting it here very soon. So I'll be sharing that when it comes out. Rebecca mentioned that the nurse will be starting August 11th, so that's exciting to move forward and get these positions filled so that we can answer the referrals that are starting to come in. And with our case management program, there's, you know, it's a lot of individuals that are on our caseload for one staff person. It's well over the max that's recommended. So we need to get our social workers some help. The Older Americans Act recently celebrated its 60th anniversary. And so the U.S. Aging made a statement, which is our nationwide association of area agencies. And the very last sentence says, is probably the most poignant to me. The Act continues to be one of the most successful examples of public-private partnerships in action and leverages $3 for every $1 invested by the federal government. As the U.S. population ages, projected to include more than 97 million Americans over the age of 60 by 2040, we must scale Older Americans Act programs that are trusted, proven, and have withstood the test of time. So it was discussed a lot this week at our U.S. Aging conference, and have a lot of great ideas that are buzzing around in my mind, especially surrounding caregiver support and services, and ways to creatively address gaps in services. So more to come on that. I also included the notification that just came 2 days before Ashley Ellsworth, our regional aging representatives, visit on site here at the health agency to perform our annual assessment. I do not believe there will be any recommendations or findings from that visit. She takes a deep dive in some of our case management system and notes, looks at our assessment of providers, looks in the personnel files. So Teresa and her team were involved. And so it's just a big sort of day-long event, and we did a lot to prepare in advance for that. A lot of it is uploaded and sent to them already. For example, she also looks at the conflict of interest and disclosure statements that you all signed to make sure that they're complete. So I just wanted the board to be aware of that, and certainly Commissioner Stoll was notified of that as well. But wanted the rest of the board to know as well. Are there any questions?
Okay. Thanks, Laura.
Thanks.
Appreciate it. All right, moving on to financial reports. We're up to approval of payments.
Yeah, so you have the bills for June before you. I would like to point out page 102, there's a line for Telnet Worldwide for $22,000. That is the purchase of the new phone system that was approved by the board. The phone system is in, and it seems to be doing really well. We like it a lot. Other than that, not really anything unusual on this run of bills. I would be happy to answer any questions.
Was that phone system funded by any of the building grants or anything like that? Or
Yes, we paid for we can't pay for the recurring costs of the monthly costs, but the phones themselves were paid for out of the infrastructure grant.
I would move to approve the payments through the month of June as presented.
Okay. Support. Okay, we have motion support. Is there any discussion? Hearing none, all those in favor say aye.
Aye.
Any opposed? All right, motion carries. Okay, we're up to the review of financials.
Yeah, so moving right along, you have the balance sheet and the cash receipts and disbursements. And then the 12-month, or the how we're doing on each grant program report. We are currently 9.85% under budget. And these numbers do reflect the budget amendment that was passed last month by this board. There are a few programs that it looks like we guessed a little wrong on, and we'll continue to monitor. And we may, shift some funds internally, to cover some programs, that, money that was unspent in other programs. But we'll continue to monitor it and move it along, because we do not intend to make any budget adjustment.
Okay.
For the current fiscal year, and would be happy to answer any questions you have.
Questions?
I would move to approve the month-end balance sheet and financial statement as presented.
I'll support
Okay, we have a motion with support. Is there any discussion on that? Hearing none, all those in favor say aye.
Aye.
Any opposed? All right, motion carries. You're the only one who voted on that.
it. He was a
Okay.
lot.
All right, committee reports. How about finance committee? Who's prepared to give that?
We met, myself and Kevin again. We only have one item, and that was to, look over the bid for the Hillsdale Building exterior renovation project. We did move to accept a bid that was $69,000. Not sure what it was, but it was $20,000. Trying to plug in there. Johnson, our job numbers. $20,000. Accept that. That's it.
It is on the agenda.
Right. That's all I have. Was Kevin wants to highlight anything else.
Really not much to highlight.
That was our highlight.
Are you gonna move to approve your minutes?
No, we'll wait.
No.
You're going to approve our minutes.
I'll support it.
Okay, we have a motion with support to approve the finance committee meeting minutes. Any discussion? Hearing none, all those in favor say aye.
Aye.
Any opposed? Motion carries. How about programs, policies?
Well, Program Policy and Appeals Committee meeting. Committee met with Commissioner Stoll and I last week. Met you, Commissioner.
We did. We did indeed.
As Rebecca said, there's a couple of things primarily that we went over. One was the workforce development plan, which is later on in our agenda, talked about. The other one is the employee satisfaction survey, and is part of the health officer evaluation policy that we have. It's required that we get that in writing at least a month before the health officer's evaluation. And since how the next regularly scheduled Program Policy and Appeals Committee meeting, I have a conflict that day, so I wanted to make sure that we had that committee meeting so we could discuss this committee, bring it to the full board, and so that all the board members had it, because I don't anticipate us having that committee meeting in August before we start the health officer evaluation.
So do you have a suggested date on it?
No, we're not gonna meet.
Or we're just playing that?
Plan is to not meet in
We're
August.
off hook in August.
Got it. Good.
The only thing that would change that is you be here then.
Yeah.
The only thing that would change that, Commissioner, would be if the agency receives an appeal on something that we would, that the committee would have to meet to then hear that appeal and then make the recommendation for the full board meeting in August. So, but with that, I would move to approve the Program Policy and Appeals Committee meeting minutes as presented.
Support that. Okay, we have motion with support. Is there any discussion on that? Hearing none, all those in favor say aye.
Aye.
Any opposed? All right, good job. Motion carries. All right, moving on to unfinished business. We have the MERS surplus drawdown. Had some discussion on this already, but
Yeah, I just wanted to, because it's not been resolved, but we don't have additional information. I've been working with Marnie to get a new actuarial study done. They were waiting for some table or something that had to be updated at MERS. That has been completed, and now We have our place in the queue. He thought we would have more information available with the new study, within 30 days. So, but it's not exactly sure. He didn't know that already.
Okay.
So look forward to more on that next month.
Yeah, and she's supposed to get back as far as the option or the question that her letter raised too. So. Okay, so we'll leave that as unfinished. Moving on to new business, we have the Hillsdale Building Exterior Renovation Project bids.
So if I may, the only thing I would add is that the contractor, R. Johnson Builders, is one that's done work for us in the past. They were the ones that completed the exterior work on the Three Rivers building. So we do have experience with this contractor and the work that was done in Three Rivers. We're very happy. So.
Say it's located within our three counties.
My only question, and I didn't really go and look at the bid specifications till after I saw the bids come in. And I guess the only thing I'm questioning is, why are we taking that board off and replacing it with a high dollar piece of plastic board when we could just, to me, the cheaper option is just to wrap that with aluminum and move on.
We had a contractor provide, expert suggestions with regards to what we should do there, and that is what was recommended, so.
We've worked with both a contractor and an architect, when we did the Three Rivers building. And, this is the same product that we just recommended. Yeah.
I'd say you have to trust your contractor. I mean, right, I'm gonna guess, you're not a licensed contractor?
I don't know offhand, that is not good. As much as I might like to.
Stuff I'm good at, I don't get truck with it.
Again, but me, and I don't know that what the cost would have been to spend that, aluminum sheetings to get around those boards, the way they're installed there. Commissioner Collins, did you stop and look at it? Yes, and it would be very tricky. Because it does come down. The board comes down and then it goes in and the width of the board and then back up a half an inch or inch or. Interleaf and then in back 4 inches. And I think it would be doing metal. I have worked construction and breaking metal that quick of bends would be almost impossible.
Why they recommend the other.
And the thing I can see with the other is if we do wrap it in metal, something was to happen to that, then you're gonna have to take down the soffit, the face of the other one to replace this, where this could last a lifetime. And there are in some of them 45s on the corner of the buildings, there's some gaps in there I mean, 1.5 inches, 2 inches. One that I looked at, it's like, holy crap, birds can be flying in out of there. But that's a great spot for bats to go. Yeah, exactly. But I mean, that's my only thing is this would be a permanent fix, and they would never have to worry about it again. Where the metal, right? I know. Part of it is the desire to replace the wood too, because I know that wood has been known for being unravelable by bees and wasps.
All right, does anybody want a motion to?
I'll make a motion to accept the bid for $69,000.
Oh,
okay, we have motion support. Is there further discussion? And hearing none, all those in favor say aye.
Aye.
Opposed?
Aye.
Motion carries. All right, we're up to the workforce development plan.
So, I kind of talked in very high level terms about this plan. If you wanted to look at Anything in specific, we can certainly address those, but you know, this is our guiding light for the next year or so, and provide some training that our staff will need to engage in. It's always good to have a plan so that we know where we're going. Teresa also has been very involved with this, as well as Chris. So the three of us looked at the existing plan and did some updates, and Teresa tackled the, what do you call it? The formatting, which was not for the faint of heart, I guess. Is there anything more you'd like to know about it?
It's modeled after an existing plan that was just redesigned.
Okay, right, we want to formally adopt the plan.
That would be wonderful.
I so move, Mr. Chairman.
Support. Okay, the motion with support, is there any discussion on that?
Now the 24-25 workforce, what we, how we doing?
I don't remember.
We did not have one, we haven't had a formal plan based on, pandemic era issues. This is our first step back into, getting on formal track.
Yeah.
All right, any other discussion? Hearing none, all those in favor say aye.
Aye.
Opposed? Okay, motion carries. All right, so we're up to the employee satisfaction results.
Starts on page 135, and that's where you'll find that summary information over the next 4 pages. Green, we do the key.
Yes, the
Yeah.
key is there, and,
Yeah.
and thank you, Teresa, for there were some changes that we requested at the Program Policy and Appeals Committee, and that was one of them, that we needed a key there. The other key thing is, and it's bolded in yellow on the 3rd page in there, is the first few questions at 5, I believe is the top score you could get. Okay, but then you get down there to question 42, and there 1 is the best score. So for some reason that survey flip flops, that 5 is good and then it goes to 1 is good. So
You see variation every year. You know, it ping pongs a little bit. As long as the changes are small, I consider those to be fairly insignificant. If we had large swings, that would be something that we definitely would want to focus in on. Our employee satisfaction committee will be taking a look at this Monday, I think is when we meet next. And they will look through this and try to identify areas where they can do some quality improvement initiatives, and we'll tackle those. So.
We discussed this at length, I would say, at our committee meeting, so.
and forgive me, Teresa. Okay, response rate of 79.17% of the staff this year.
We talked about, yeah, so good response rate.
Good comments, I it was just
And, okay, we don't have last year's percentage participation, but went from 49 to 57, so I'm gonna guess that percentage was lower a year ago on the response rate, so.
We don't recall.
Okay, any other questions about the employee satisfaction survey? I don't think we have to adopt anything here, do we?
It's just information.
And again, it's, you know, it is in paper, for you, so that you can have, please keep that for the health officer evaluation. That'll be coming after the August Board of Health meeting.
Thanks for the tip.
I'll send it to you again.
If anybody misplaces a copy. All right, we're up to our second public comment period. If anybody would like to address the board. I'm sorry? You may, yes.
Julie Klein, again, I heard what you're saying, I get it. I think some of you may also understand my frustration. To me, this sounds like a very frustrating siloed approach that each department has their piece of the pie of monitoring the waters. The frustrating part as a community member, I think we also need to look at a common sense approach with the wastewater treatment plant, putting water into the chain of lakes at South Lake. They're doing it under regulation, so it's not that it's not being regulated. We don't know though, when that combines with the agricultural runoff, the solar farms being utilized in our water source. Personally, I have grown up here. I don't want our water sources, which is one of our biggest assets, being destroyed, and we end up like a Parchment, a Flint, Michigan. A little bit of prevention. I hear what you're saying about the cost, but depending on the water sampling that's being done, a collaborative approach with the DNR who's out on those lakes all through the summer, if not the fall. Collaborative approach with Eagle. You know, what would that collaboration look like? How could that be funded? What would those opportunities be? That maybe this can be done so we mitigate, you know, at least minimize the risk to our drinking water, to our, you know, the adverse effect. We also know with the lakes, you're living the nightmare of the septic systems failing. We have that to add to the water, right? So we have a number of factors. I'm not pointing the finger at any one. I'm just saying, let's be smart, be preventative. Prevention is a heck of a lot cheaper than taking care of an absolute disaster later on. So a little ounce of prevention might be a good approach, that we look at the cost of a $75 to a $475 check on the waters. And I mean, they just did it. They do it in Steuben County. They just released an E. coli outbreak, beach closures yesterday. So it's being done. Other counties in Michigan are being done. And again, it does come to funding. What does that look like? How can we collaboratively find funds to assist that we don't end up, because we have additional factors. And we're also, our chain of lakes is also pushing that water into St. Joe. That is going into St. Joe, who did have a sewage issue not too long ago, because I heard all about that in this whole process. I heard that the citizens didn't find out for 3 days and it became a whole thing. And why wasn't our emergency system utilized by phone calls? I found out more than I wanted to know in trying to resolve. Actually, we started out with a weed issue and it's developed into this. So I'm just asking to look into maybe some collaborative efforts in prevention.
Thank you.
Thanks.
Listening to all this, I have a question. Living on the lake. And we went to trouble doing a double septic system. My question is, how often are each individual lake owners septic systems checked to make sure they're not the person creating the issue? And who's responsible for that? If it's not them.
Again, we don't get into back and forth, but I don't believe they're routinely checked unless there's a problem with them.
Well, how do you know if there's a problem? If they're not routinely checked.
It was a house bill and a guy on the floor. So kind of got set.
That was going right away.
That was gonna regulate.
That was going to require, right?
So there is legislation that was brought, but it was not brought forward, and therefore it's died. The current legislation has been addressing. Wait.
So then there's nobody monitoring. And I mean, we'd have no problem being monitored, you know. Check. If that's not being done, that may be where a huge amount of problems. Okay, that's what I need to do. Thank you.
Okay, anybody else would like to address the board? All right, so we're up to commissioner comments. Commissioner Collins, start with you. Commissioner Houtz is always good for a comment.
I yield time.
Well, I think we covered everything, and nothing I needed to have more addressed. I think good for right now, in fact, they're ready,
See everybody up at the Traverse City Councils.
coming up.
You won't see me, sorry. That's too cold to County Fair.
That's like November, isn't it?
September.
Close.
Oh, it's
Any comments other than the fair?
Well, Orange County is what, next week?
2 weeks.
Third.
Okay, well, the only comment I would add is, to keep in mind, those of you who are lake owners, because I also own property on the St. Joseph County watershed. So the Lake Association does receive funding from the property owners on the lake. So you are assessed on your property taxes. So there's funding available to do some of that testing. You need to get in touch with your Lake Association. And I do understand how frustrating this can be to hear different agencies being involved and have different responsibilities and all that kind of stuff. Hopefully it's something will come to the legislature or something like that to address the concern. I mean, it is a concern though. So that's the only thing I would add. All right. I would entertain a motion to adjourn.
So moved. Support.
Okay, we have motion support to adjourn. All those in favor say aye.
Aye.
Opposed?
Your time. Thank you.
We are adjourned. Thanks, everybody.
Right, Joe?